When your back hurts, it can be awful.
The spine is important because it controls everything that we do.
Dr. Deborah Benzel is a neurosurgeon at the Cleveland Clinic. She knows a lot about spines.
It has two really important functions. The one function is to allow the flexibility, so it allows us to turn and bend and twist, do things like play golf and football or even just walk a baby carriage. But it also has to protect the critical neural elements, so our spinal cord and our nerves. And these are two very different functions. The strength it needs to protect the nervous structures, but also the flexibility so that we can carry on what we need to do on a day-to-day basis.
People with spine issues usually experience pain, but they can also have numbness, weakness, or stiffness.
There are many, many, many different problems that you can have with your spine. Just like any complex mechanism, you can have problems with the discs, with the bones, with the nerves, with the spinal cord itself. It's kind of a little bit like an automobile where you can have trouble over time with your tires, your spark plugs, the belts. So our spines are a little bit like that. There are many moving parts. Because of this need to be both flexible and strong, and so really any number of them can break down and cause us problems. Here at the Cleveland Clinic, we have a really unique program. It's devoted to spine health. And so if you think that you're having a problem with your spine, you oftentimes will be seen by a spine specialist, but not by a spine surgeon. And their role is to evaluate your spine and your problems and to see if it's something that really needs surgery or whether it's something that can be treated with other treatment interventions. But we also have a team of spine surgeons, and they're available if you're one of those patients that really would benefit from surgery on your spine.
If you do need spine surgery, don't panic.
These days, especially at the Cleveland Clinic, we do a lot of surgery through minimally invasive techniques and through minimal access techniques. And so surgeries that in the past maybe you spent a week in the hospital, we may be able to get the patients out of the hospital in 1 or 2 days. They're usually up out of bed the night of surgery and walking that night and the next day and able to go home and be independent largely almost from the get-go. We talk a lot in this country about, preventing diabetes, about preventing heart disease, getting cancer screening. But in reality, our spines account for 1/3 of all of our healthcare costs, and they're the primary reason why we lose time at work or have to take time off of work. So it really is important to protect our spines. And we can do this by good spine health. That means staying active, tending to back strengthening, back flexibility, lifelong back care.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.